I started getting exposed to cleft lip and palate care at about 8 years of age. My parents founded Operation Smile in 1982. And as the oldest son, I became sort of fascinated by medical care and specifically the needs of children around the world. So I've been around this work for quite a long time, and that's how I ended up in this profession ultimately. Shriners Hospitals in general are focused on taking care of children of major need, specifically the underserved, and I think in that population it's a tremendous honor to practice. I think what you come to realize is that the world is changed by emotion, and it can affect your own life. And I remember the first powerful moment in my life that ultimately had a major impact on my career. It was a time that I had traveled with my father to Africa with a close friend of his who was a surgeon from Nairobi, and we were walking down the hallways in a burn ward where many, many children lived in this orphan unit that were not being cared for. And the hall didn't have a lot of light. And so when the kids came to the doorway, you could see the sclera of their eyes, and the sclera of their eyes lit up. And as you watched them closer and observed them closer, each of them were imprisoned by the deformities created from the burns. And it was a very powerful moment for me in which I really understood that so many children around the world have no access to care. And these kids were orphans, and they were placed in a facility where there weren't enough surgeons to take care of them, in the hopes that someday there would be a group or a person or a surgeon and a nurse who would come to take care of them. And it was at that moment that I really believed that my life could have an impact. It could have an impact, not just becoming a surgeon hopefully someday, in helping to design systems that would help more kids from around the world. My focus in patient care is one child at a time. I feel that the best way to take care of kids is when you're truly focused on each individual patient. Anytime that you get distracted by the volume of patients that are coming through your clinic, it inhibits your ability to perform excellence. It's truly important that you focus reconstructive surgery one child at a time. It's also very important that you observe all of your outcomes. It's important that you see the quality of your work and that you make adjustments day by day to continue to focus on improving the quality of the work that you perform. Any children or any families that are living with deformity out there in the world, the doors are wide open at the Shriners Hospital. This is an amazing place with a culture that's focused on taking care of kids. So there should be no resistance to seeking care. Not all problems have surgical solutions, but many of them do. And that's why we're here.